Good afternoon. Oh, I've got a black thing on my face. Let's just get rid of that. Thank you very much. Right, good afternoon. Welcome to this session of Diversity in Mental Health. Ama is with us. Delighted to have Ama with us from Mental Health First Aid England. It's an honour. So it's one of our highlights and our highlight keynotes for the digital summit that we've had over the past 2 days. So thank you very much for joining us on this discussion in terms of diversity and inclusion and mental health. A very, very important discussion. Obviously, right on it at the moment in terms of everything that's going on in the world and the Black Lives Matter movement, the mental health impact of COVID-19. So it's a really, really important conversation for us to be having this afternoon. So welcome, Ama.
Thanks for having me.
Good to have you here with us. So Ama is a valiant culture builder who helps companies from startups that are scaling to full-blown corporates and create and foster an inclusive culture focused on people first. Don't we all love that idea? Don't we all love that idea? But roughly, and just on that matter alone, roughly, if you were to give a percentage of companies in the UK that had an inclusive culture that focused on people first, what kind of percentage do you think you'd put on that?
Oh, was this pre-Black Lives Matter or before or post? I think it's an interesting one. I'd probably give it. I'm just giving it a bit more of a positive note, but maybe 45%.
That's better than I expected you to say.
I'm probably boosting up the percentage, but yeah, I think probably between maybe 20 and 45%. Yeah. And the reason why I'm saying it is because I guess I'm including those that want to have good intentions about doing it versus those that just haven't even put it on their radar. But I'm pretty sure if we were to do a real survey, it'd probably be a bit lower than that.
Yeah, because it's quite interesting, that percentage you've given there. So you guys are familiar with the Thriving at Work review. EventWell's familiar with the Thriving at Work review. If you're not familiar with the Thriving at Work review, you can find a copy of it on the EventWell website under resources. Have a read of it. A report was commissioned in 2017 by Theresa May. It was written, and the review was carried out, and then the review was written by Lord Stevenson and Paul Farmer, who's the CEO of Mind, and out of that came 6 core standards that businesses should be implementing in terms of the well-being and mental health of their staff and teams. Last year, it was identified that only about 24% of UK businesses in the 2 years that the review had been out had actually implemented any of those core standards. So it just goes to show that even though we're having these conversations, you know, that mental health, diversity and inclusion in the workplace from a mental health perspective is still not being addressed as quickly as some of us would like it to be, is it?
Yeah, and that's why I'm laughing, because I'm like, I know all too well, and that doesn't surprise me at all, which is probably why I put it in a bit more higher level, because I think pre-Black Lives Matter, and especially stuff that's going on with COVID as well, it probably was very low, probably a little bit lower than that. I think now companies are probably trying a bit better. Again, I say probably because everybody came out with their statements of intent or their statements, but we're yet to see the action. So let's see.
Yeah, absolutely. So we kind of hope in a way, don't we, that the pandemic and the Black Lives Matter movement is going to really, I think personally it's triggered something. I'm starting to see some very positive changes taking place, and conversation, at least if change starts from just listening, learning, having conversations, all change starts from there. So it's quite encouraging to start to see that happening, isn't it?
Yeah.
What we kind of wanted to have a chat about and talk about here is specifically mental health and how it affects Black and minority ethnic communities in terms of their experiences of mental health support, mental health treatment, mental health and well-being in their community and in the wider community, but also mental health and well-being for at work and in the workplace. So I thought we'd have a look really at the kind of mental health treatment and support first of all. So there's stats out there you can find, and Nan, you've asked about this study again, so that we were just talking about. It's called the Thriving at Work Review. It's on the EventWell website, eventwell.org. It's under resources, and you will find a link to the report there. When we go into the Q&A section, I'll quickly nip off and I'll get the link there and share it with all of you so you can have a look at that review. But to take it back, so looking at kind of mental health treatment and support and diagnosis, I think is the most important thing, because diagnosis across the country is sketchy anyway, if I'm honest. It can be a bit of a postcode lottery just from an overall thing. I'm from the Northwest originally. I'm not from London. I live in London now. And I can probably say I've lived in a number of different towns and cities around the Northwest, depending on where I've worked. And I could say that my mental health treatment as a white person has been very sketchy in the Northwest in comparison to the mental health treatment that I've had in the Royal Borough of Greenwich in London, which has been outstanding and amazing, dependent on the resources and amount of you can tell when funding and resources have been reduced, because the level of service you receive tends to be very different, but still at quite high standards. So I'm lucky, and I always say that I'm lucky that I live in Greenwich and that we get that treatment. But it can't always be said for Black people or people from minority ethnics, kind of in terms of that diagnosis and treatment. It took 20 years for my diagnosis, because of my experience of living in different places. But when we talk about the Black community, so Black men are 10 times apparently more likely to develop psychosis than white men. Black women, I don't know the exact stat on this, but Black women are more likely than white women to develop depression. So I thought, Emma, it would be great if you could just go into this a little bit more in terms of that whole, from experiencing those first symptoms to getting a diagnosis to treatment. What's that journey look like for the Black person in comparison to a white person?
Probably not very supportive. And again, I can't, like I said, I can't speak for every single Black person, but I think what I'm talking about is predominantly maybe representation of most. But I think you raise a valid point. The fact that you said your experience living up north was different to coming into London, I think the resource and funding is one big factor of it. Where is the funding and money going to ensure that communities are served properly? So if you are having that experience in up north, just imagine the people of colour, Black people, what they're having up north, because in London they're probably having the similar experience, even not more worse than what you were having up north. And I think the key thing is around the access to that support. Not only just the access, but who's doing the diagnosis. So again, if you look at who is actually listening and supporting and seeking help, most 9 out of the 10 times when you go to your GP, predominantly white GP that you see, you're trying to explain what you're going through, they don't even have a clue. And then what they do is they paint you the same brush as everybody else that they are dealing with, because that's the majority of who they're dealing with. And they need to take time to understand that there are certain things that might factor into that. So now I think it's also twofold. I do believe that there's an element around community support. So as a support from Black communities, we do need to do better to support ourselves and understand that we need to help ourselves to get better and actually get that better access. But also, more predominantly, more fundamentally, that's just a minor piece. The majority piece is even getting that access and be seen as individuals in that access, rather than just a group of people that people are just analysing and not even understanding. So it's very crucial that, and also understanding that mental health is an individual journey, full stop. So how I experience mental health is different from how you will experience mental health. And subjectively, the way I live my life and all the other layers, if you want to think about, if you add anything like prejudice, racism, social inequalities on top of that, that also impacts my mental health in a different way to yours. So if I'm sitting there talking to my GP or whoever it is I'm trying to get access to, and they're not even thinking about it on that just basic level, and it is a basic level, there's nothing stopping you from thinking about this individual is dealing with it differently. What are the actual factors going on in their life to them being in this position? And then what is the support? Where do I then signpost them to the relevant support? And each step of the way, as an individual or Black or people, a person of colour, if each step of the way I'm being questioned about how I'm feeling, not being listened to, and then being misdiagnosed, and then being given support or signposted to support that, again, is not supporting me because they don't understand the fundamental cultural nuances, differences, and all the other elements that come with me as a Black person and the community and the the hardships or whatever it is I'm going through, it's defeatist. So you might as well just shrug your shoulders and go on with it, because like I say, and it comes back to, I mean, you quoted some research there, but it also comes back to who's doing the research, and are those research groups being really representational in the diversity of that? So for me, that's the crux of it. It's actually who is actually giving the diagnosis.
Yeah.
Are they diverse within themselves? Are they educated? Are they learning about the different cultures? I mean, we talk about London being a melting pot, but for London being a melting pot, people still don't get the differences and the struggles and the lived experience of Black people and people of color within that. But they want to talk about how cosmopolitan we are as a society. But there's no reflection on that and the key things, whether it's education, whether it's health, whether it's criminal justice or justice, whether it's, you know, in the corporates or business. There is not enough representation to have the voices amplified, the experiences lived, and the change to happen. Yeah. So what ultimately you find is a lot of people are probably being more incarcerated or more sectioned or more, you know, put into even much more risk because just of the element of just not even understanding where they came from or having that representation within those roles to be able to diagnose better.
Yeah. And just to touch on that, actually, my psychiatrist is a Black gentleman. So maybe, and a lot of my support team, so my crisis team, are people of colour. So maybe that hits a nail on the head of exactly what you've just said in terms of the difference of my care, not just as a white person, but as someone with a mental health condition, that my support team, from my GP to my psychiatrist, and all of those people in between, because normally you have a team of mental health people that are supporting your crisis team that have been assigned to you. It's to have that diversity in that team. Maybe it shows that reflection of me actually talking about the difference of my mental health care experience of how it was in the North.
Absolutely. And the thing is, like I said, my experience will be very different to another Black female's experience. So again, don't group us all in the same bucket because we're Black. Do you know what I mean? And I did a search the other day and I was just curious. I was looking for a therapist in my area and I specifically wanted to see if there were any women of color or Black women on that. And out of a search of close to 60, I found 5. I was alleviated to find 5 because at least I know there's 5 in my area I can contact, but out of 60 people. So again, that comes back to the point of when therapists or whoever are training for or being trained in the industries or sectors that they're being trained for, again, where is the representation in that? How are you going to market for more people of color and Black people to be part of those institutes, for a better word, so that you do have that representation? What proactively are you doing to change that? Because it definitely needs to change, and more research, more real, authentic research needs to come out about the lived experiences of Black people in mental health institutions and just the mental health journey, and actually dissect into that to really see what's different. You know, Black women are more likely to die giving birth in pregnancy than their white counterparts. How?
There's so many inequalities, isn't there? That kind of, as much as we all love our NHS system, guys, there are so many inequalities that are part of that systemic racism within the health service. It isn't just, we talk about postcode lottery, it isn't just that. There is systemic mistreatment of people based on the colour of their skin across the NHS that really needs to be addressed and looked at. And like Haim was saying, in terms of making sure that equal representation is results in equal treatment and fair, just treatment for all people, but particularly for people of colour and Black and minority ethnic, because there are systemic inequalities and problems in the system as well. I mean, if you look at social economic equalities, I wanted us to have a chat about this. I touched on it briefly. The event industry, I like to say the event industry is a young industry. The vast majority of people who are working in our industry are young. It's only I tend to call us the operation freaks, the ones who strive off the stress that end up staying in it for years and years and years, kind of stuff, and never go on to do anything else. But predominantly, it's a young industry. Young people are more susceptible to mental ill health and stress and anxieties than older people. You're more likely to develop mental health conditions when you are young than when you're older. So I have bipolar, for example. Yeah, the vast majority of people who have bipolar develop bipolar in their teens or in their early 20s. So when we look at social economic inequalities, then for 16 to 24-year-olds in particular, unemployment rates are highest for people from people of colour, people from black backgrounds. It's 26%. Bangladeshi and Pakistani backgrounds is 23% in terms of unemployment rates. For white young people between 16 and 24, it's 11. It's 11%. So there's a massive difference there. If you look at those, black and ethnic minority groups are likely to be paid less for people doing the same job. So there's been so much talk about the gender pay gap. We need to talk about the race pay gap as well. Ethnic communities consistently have higher rates of poverty. 37% of homeless people are people of colour and black people. So it's when you look at all of these factors, I mean, it's what. Where do we even begin, Ama?
We have to begin somewhere. I think, again, it comes back to who's accountable and responsible to make that change. And I think it's interesting that you do say that, mental health problems, issues, conditions start when you're younger. And I think what happens is you get to a point when you're older and you realize that something's not right. But because you've had to deal with all this trauma as you're going through life, you didn't realize it at the time, again, because it might have been you just shoulder on, you just kind of get through it. And I think that's one of the biggest kind of mindsets of people of color and black people, is that we've been living this experience for our lifetime. So rather than taking a step back and just having a moment to be like, this is, I need to breathe, for want of a better word, we just soldier on. And I think when you look at it's again, it comes back to access and privilege. When we look at privilege, the reason why our white counterparts are excelling more, getting the opportunities more, is because look who's actually giving them those opportunities and who are in positions of power to do that. Again, the statistics show, and you can even Google it, it's not just me saying it, the statistics show in every area of life, white people have predominantly been better off than people of color, minority ethnics, I hate using that word, but people of color or black people. And for me, the key thing here is to just accept that there are so many statistics, if you just Google them. And the thing is, it's like, in the world that we live in today, there is nothing where you cannot access information. And when people ask why, I've been in organizations where I've been told, oh, we want to hire more black graduates, or we want to hire more black people, but we don't know where to find them. To which I'm just looking at them like, you found me, and they're just out the door. And it's like, and then when they see, exactly, and then when they're exposed to, I get this often, not often, but when I used to work, right, they're exposed to them, like, oh, they're so talented and so smart. Again, another microaggression where it's like, so what would you expect them to be? So I think the frustrating part is, whether it's to do with corporates, whether it's to do with wealth, it's equity. That's what we're talking about. And the equity lies with the majority, and that's white privilege. So unless those who are hired into those positions are, again, diverse, those who have been given the power of influence and are influencing, again, are diverse and are from, black, people of color, minority ethnic backgrounds, you're going to have the same old same. It doesn't matter if they are 24 or 26 or they are 50 or 35, whatever age they're in, they will be experiencing the same thing. You always have a bottleneck where the majority of people are hired into roles are within sort of the manager and the junior roles, but never escalating in the ranks of senior management. Why is that? Because there is definitely institutional racism within the corporations that we work in and within the institutes we work in. So the lens that is applied, there's nobody challenging them. There's nobody looking at them in a different way or a different light to say, actually, well, let's think about the experience of these individuals. Are we making decisions? People are making decisions for people who are not at the table, or they're making decisions for people who are not asking those individuals their input into that. So they just get left by the side. So, when you are coming out through life, and self has its struggles, like, we all live life, we all going through our struggles, with the extra layers added where you are constantly being pushed down, constantly being told you're not good enough, constantly being seeing other people, being promoted or be given opportunities that you equally deserve because you are just as good enough, if not better, impacts your mental health and well-being. So, that lens, especially from a cultural perspective, or a diversity perspective, is really crucial in that. And until that changes, and until those people in powers of influence and in seniority understand and check their white privilege to see that they are actually the people that can change that and use their white privilege to be better. We're talking about social justice here. We're talking about humanity. There is no way an individual in 2020 should be having half of the struggles that we're having right now.
No, I completely agree.
And I see, like, I'm just seeing the statements around, I think recruitment is a key area. I agree, recruitment is, but I think it's more, you can recruit 1,000 people of color and Black people one day, and that 1,000 people will leave the next day if they don't feel included in the cultures you are building. So another thing is crucial is, as much as it's about the hiring, yes, that is definitely a crucial thing. In order to see diversity and representation, you have to hire them in. But if those people that you're hiring in don't feel that they can bring their whole selves to it, don't feel that they are actually valued, don't feel that they have equity, don't feel that they're having their voices heard, that they're actually contributing, and that they're actually making decisions that make change, why would I stay? The only reason I would stay is because I'm stuck. But if I'm not stuck, I'm going to go. So there's something crucially fundamental about building the right cultures and inclusive. And we use this word so many times. I don't think organizations really know what that means. Some organizations are doing it very well. But an inclusive culture is, how do you serve the workforce that you are recruiting to ensure that they do feel that they are valued, that they are heard, and that what they're doing is making a difference and impact, and that they are on a level playing field where if they've got the skill, if they've got the contribution, they should succeed. Because if not, and they should be paid for that. If they are truly worth that, which they are, why are you not paying them for that? So you mentioned about the gender pay gap. We need to look at an ethnicity pay gap. It's atrocious. And even when you look at the gender pay gap and you divide that down into ethnicity, that in itself has an issue. So for me, it's very much, yes, recruitment, but if you want to keep good talent, it's about the culture. What behaviors are you exhibiting? What policies are you putting in place? What systems have you got in place that are actually hindering people of color and Black people from succeeding compared to their white counterparts?
Yeah, absolutely. Natalie just asked the question there, what does culture actually mean? I find the word very confusing in the corporate world. So corporate to culture, just to explain it very, very simply to you, the culture of an organization, this is the way we do things around here. That's your culture. Okay.
It's the way people behave. Yeah. It's the way people behave.
The way you treat,
it's the way things are done.
Yeah.
We don't, so if you're saying we don't do that around here, it's because that's the way we've always done it. So it's how people behave and put things in place to make people behave in a certain way. And for me, culture definitely comes down to behavior. It's a feeling of, do you feel that you can be yourself and belong here? And if you don't, that's because either somebody is not giving you the opportunity or somebody is behaving in a way not to give you the opportunity. And that's what it comes down to, quite crucially, around culture. So it's the atmosphere you're trying to build, but predominantly the behaviors that are modeled in that environment that create the culture of it is. So, we've often heard of toxic cultures or, really great, fun places, cultures to work in. Again, it's what you put in place for people to feel that they can be themselves to as far as an extent as they can, but it's predominantly led by behavior.
Yeah. And it's such an important conversation that we have all the time in terms of culture and that impact that it can have on people. Because, Ama, you're completely right. Recruitment is key and it's really important. But what's important, guys, is, your talent that are people of colour as well as your talent that are white people. It's about looking after your talent. So recruitment is only one really, really tiny part. You want to keep your talent. You want your talent to stay with you. You don't want your talent to be swayed by an interview and think, oh, it's going to be amazing here, and then get into the organisation and realise it's not quite the way it was portrayed in the interview and that whole recruitment process. And it's a bit like, I'm out here. I'm going somewhere else. Because
and
people do that.
Yeah, and that often happens a lot. You get missold.
Sold the dream.
CPI, as they like to call it. Missold the dream. And then you come into the organization, you're like, okay. And most of the times when missold a role, that's different. So if you're missold a role and then you're also missold an environment, you're like double jeopardy. So first of all, you hire me to do a job that I'm not doing. And secondly, you're hiring me in a culture that you said was great, but actually I feel quite isolated, quite frustrated, and I can't really be part of that. And I think the key thing to looking into how you change your culture is looking at it from the other side in. So what is that employee experience journey for the individuals that are coming into it? You know, from when you are attracting them, what does that look like? When you're going through the recruitment process, what does that look like? When you're inducting them into the organization, what does that look like? But also your learning and development opportunities. If you've got a leadership program, what does that look like? And actually, are you being intentional when you select who goes on it? Because there's the thing, are you checking your biases at each point of that life cycle to understand where your perception is coming from and whether that perception is right?
Yeah, because we all have bias, don't we? We all have bias. Every single one of us has bias, whether that's biases to between white and black, biases between brown and black, biases between young and old, biases between men and women. We all have biases, and it's us recognizing what our biases might be and how that impacts how we work, how we do our roles, how we interact with other people, how we manage, how we recruit. Exactly what Ama's saying. So it's having that better understanding, isn't it?
And I think when you put the lens of well-being into that equally makes it more amplifying. So I always recommend and advise that you don't dissect individuals according to, I guess, if you're looking at the Equal Opportunities Act, we're not all strands. We're actually probably into the word, again, another buzzword, intersectionality. We are many different strands of inclusion. So the inclusive experience is all about, again, how that individual is feeling and also how they're being treated. So if I feel that I can't be my whole self, or not, and again, this whole thing about being your whole self, I just want to say is that it's an option to want to be, not a mandatory. But unfortunately, we still live in a world where people opt out of being their whole selves because there's psychological safety involved, because they don't want to be penalized by really being who they are and actually, you know, being open about that because of the wrath of what people might say, or because people might judge them in a different way, or that might stand in my way of getting a promotion, you know. So it's all these things around, again, coming back to the environment and the culture you're creating, is that people want to opt in because they feel that they can trust, that they feel easy, they feel that they can, you know, I choose when I want to be me. I don't have to hide that. Whereas now a lot of people are hiding because they can't choose that. And if you're thinking about, if you're constantly covering, if you're constantly checking yourself, if you're constantly having to deal with microaggressions, and microaggressions could be statements that are said in the workplace of, oh, you're so articulate. I didn't know that you grew up in, for example, Ghana, where I'm from. Oh, you speak great English, or blah, whatever that microaggression might be. And on top of that, I'm having to deal with COVID because I'm worried that, you know, I'm part of the population that it's actually impacting the most. If all of these things on a day-to-day basis, and I'm just trying to live on a day-to-day basis, and then I'm having to come into work and then have to deal with that as well, it's not a brainer how it impacts my mental health. And then at the same time, I can't share with you how it's impacting my mental health. So I'm now having to deal with my mental health and the pressures of work and pressures of covering, questions of everything else by myself, because there's no one I can talk to who resonates, that looks like me, that I can talk about it in that level of that pace. So when you're talking about mental health, that is it impacts inclusion and mental health, to me, go hand in hand, because whatever you are denied, whatever you are not given an opportunity for, only impacts how you feel. And then creates more stress and creates more other things. So the question then becomes, when you're looking at mental health and well-being, it's good to have all these great things that in the workplace that help support individuals. But again, how is it really supporting those organizations, the individuals you're employing? Have you asked them about the things you've put in place, whether it's an EAP system? Do you request from your EAP system that they actually make sure that they have diverse therapists there? You know, when you're sourcing out things to do with clinics. I know some of the bigger corporates have in-house gyms and clinics and stuff like that. Again, what is the representation there? What are you looking at for that piece? Everything has to. I understand you can't serve everybody at the same at all at once, but you can serve the majority if you can. So I think looking at it from a mental health and well-being perspective, again, is checking in and saying, just the basic how you're doing should be changing to how you're doing. It should be more deeper than that. But they go hand in hand.
Yeah, they do, absolutely. So I just want to give just what Amy's just said, just to kind of give some perspective on that kind of stuff. Imagine, because anybody who has any kind of thing that could be prejudiced against, so whether that's race, gender, health, sexuality, all of those kind of things, have experienced, not on a level of people of colour in terms of racism, but have experienced microaggressions. We've all had the comments. So imagine, I've had comments where I've met people and they've turned around and said, "Oh, you're not as wild as I thought you would be," or you're actually quite clever," kind of stuff. They're expecting, because I have a mental health condition, that I'm getting, I don't know. It's just those eye roll moments where you're just kind of going, "Oh, right, okay, yeah, great." So imagine what it must be like for a Black woman in the workplace, Black, female. So you've got those racial microaggressions. You've got the female microaggressions that you get in the workplace, because again, we've all had those comments in the workplace as well, haven't we? And then you also have a Black female who has a mental health condition that she's had to declare, and I've had to put my mask on so many times across my career. Imagine, it's exhausting.
It is. It's constantly exhausting. And I mean, yes, as a Black woman, but also for Black men, do you know what I mean? Because the opposite is where they, we always have this conversation about men not being open enough, again, to display or show that if they're going through a mental health problem or issue, because they're more closed up. We women, we tend to be a bit more open and talk about it and find our circles to talk about it. Men don't necessarily do so. Yeah. So if you, again, add a different lens onto that and apply it, whether they're Black or people of color, men have, and it's all living towards these expectations or stereotypes that are actually really should not be in the workplace and should not be permitted in the workplace or even outside of the workplace. But it's ultimately like you come into these, I guess, for want of a better word, this building, and then suddenly everything is infused and it's like the walls are closing in because you suddenly have to act and behave a certain way. And that way is not true to your authentic self. We keep talking about being authentic and we want authentic leaders, etc. But how many leaders are truly authentic? How many leaders are truly wanting to fight the good fight, for want of a better word, and actually put their hands up and say, as a leader and as someone who is a leader in this business or this society or this organization, this is not going to happen anymore. These behaviors are going to stop. We're not going to be doing this. And I'm going to role model those, hold those accountable, and those that don't want to can leave. That never happens. Very rarely.
Very rarely. And we can only hope that we start to see change to that. It's the secret to this really is removing all biases and prejudices for everyone really, from the workplace as much.
Yeah, I think it's an interesting thing because I don't think you could ever eliminate bias. I think you can move it to as much as degree as possible, but I don't think you could ever eliminate, because we're hardwired. So what we need to be doing is catching ourselves in our biases so that when it's happening, we stop them from happening. So you can lessen it and you can stop it to that degree until you become second nature, where you always have it. You'll know this is a bias and I need to check that. And why am I thinking that way? And actually, if I can't see clearly about that, who can I speak to that will challenge me enough to let me realize to make the right decision? Because ultimately, it comes down to the decisions. Decisions that are made have to be made for the right people and at the right time and for the good of mankind, for want of a better word. But you know what I mean? It's the decisions that we make that impact the lives and the livelihoods of people. So coming back to my point is, you shouldn't be making decisions about people that aren't involved in the process. It's just like I say that you wouldn't, but some people do, but you wouldn't create a well-being program, or you wouldn't create a program or initiative without consultation of the people you're creating that initiative for, and then get upset about it when it doesn't work. Or what do you expect? The voices that were supposed to be in the room and around the table and actually input into making that weren't there. And that's exactly the same thing that's been happening over and over and over again. And I'm talking about more so institutions, corporations, because those systems have been in place. Unless somebody comes in and says, okay, we're not using these systems anymore, we're going to use a new system. How do we go about doing that? And it's even harder to do in bigger organizations because, again, it's so systemic, but also the systems are so very much there for years. Mm-hmm. And to change it would probably cost loads of money, blah, 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 blah. But the question is you can change it. So how are you going to, what small steps are you going to start taking to change it? And also what radical moves are you going to start doing to do that as well?
Yeah, perfectly. I say this all the time, that any conflict resolution, any kind of resolutions or change requires both parties to be sat at the table. There's no point, it's never going to, change is never going to happen. Things are never going to be moved forward into how it should be in modern society, in modern life, unless we are all present at the table, contributing, giving our, and having our say, and saying, giving our thoughts and opinions.
And that's the key thing. It's not about being sat at the table. If I'm sitting on the table, yes, my voice better be heard. And why am I sitting on this table? If I'm sitting on the table and I'm not contributing or making any, getting any decisions, being able to make the decisions or influence decisions, then why am I sat at this table? So I think it goes beyond having a seat at the table. It's very much, I'm at this table and I'm contributing and I'm making a decision and my influences is making an impact. Otherwise, don't invite me to the table. I'm better off not being there.
Exactly. And it's not about making people work harder either, is it? Yeah. That's the completely wrong idea about this. It's about listening to people. It's about allowing people to be heard. It's about listening to their experiences and allowing people to contribute to the conversation and make their contribution, which impacts really nicely on mental health and well-being. Because if everybody feels that they have the opportunity to contribute, purpose, spirituality, all of that kind of stuff, it is a massive contributor to positive mental health and well-being.
Yeah, absolutely. And I think creating those positive mental health environments is very much around people not feeling overwhelmed because they have to carry the load, or feeling underwhelmed because they're not being utilized to the best of the abilities. I think it's very much around understanding, again, people's pressure points, and also understanding, again, coming back to my point, the mental health journey is very unique. So when you have an organization of different people will be experiencing things in different ways. So, at Mental Health First Aid England, we're a social enterprise. We want to, help the nation by, training 1 in 4 people around mental health awareness and where they can signpost people to. So again, if people have got mental health first aiders in their organizations, my question is are you, making sure that is not a sidebar of their day job? But, if I was up to me, I think all managers and line managers should have mental health first aid training, because they need to understand, as a manager and a people manager, you are managing people. So again, it's understanding your teams, understanding the dynamics of your teams, and also understanding that what are the pressures and peer points. You can be flexible and adaptable enough to shift when you need to, and also within this representation of mental health first aiders, there should also be a variety of people of color and diversity. Because again, if I'm going through this, we talk about wellness plans and return to work plans. And if an individual, for example, if an individual has to come back to work or has to go through wellness plans, and they are constantly changing their managers and they have nothing to, there's no kind of, I guess, legacy or something to show that, this has been my previous experiences. And as every time I change my line manager, I'm having to explain to you my experience again and again and again. Mm-hmm. That is exhausting. Yeah. So just imagine, as a person of color or a Black person, again, I'm going through my experience and I have no one to talk to. Or if I go to a mental health first aider who doesn't resonate or look like me, and I'm having to then relive my experience because I have to educate them about the journey I've been on and then tell them about the experience. That is overwhelmingly exhausting. Yeah. So again, it's thinking about, where do we take off the pressure points for people and make it that much more easier for them to want to open up and share. And when they do open up and share, we ask the right questions, and then we signpost them to the right support, and we keep checking in thereafter, because we don't want to have that individual relive the trauma of the experience time and time again, because they're already trying to get through it. And it's just, it's people like, oh, it's so hard. It's not. It really isn't. People just haven't really been bothered to want to do it properly before.
No, absolutely. And that's the stuff that impacts the culture of an organisation as well. And it's about taking it seriously. So I work for Royal Greenwich Heritage Trust part-time at the moment. I'm the marketing communications manager. I'm part of the leadership team. We have a mental health first aider within that charity. All of the leadership team have been sent on the mental health first aid champion course. So we're all mental health first aid champions. And everybody else in the organisation has done a workplace wellbeing program with Mind. And so everybody within the organisation has changed. And you know what? It's as simple as doing that. So don't just train up one mental health first aider that might be John that sits on the front desk and lets people in and out of the building kind of stuff, because you think that's probably the easiest person to train up. You know, think very, very seriously and carefully about the right person for the role, who is exactly what Ama said. It's about embracing it and taking on that role seriously, to help that become and develop part of the culture, part of this is the way we do things around here. And that's the big difference. That's the big difference. But the easiest way is it's basically just train everybody in mental.
Yeah, that's our ambition and our goal, to train everybody, but also to give support to those people who are trained, because we have the saying in mental health first aid that you can't pour from an empty cup, which is true. If you're depleted in energy, you can't support somebody else. So I think it's crucial to support those that are supporting others, because it's a circle of kindness and healing, right? So you support those that support others, and then and so forth, and it comes back to you. But I think it's just really interesting. And I mean, I've been trained. I actually was trained in mental health first aid in 2016, but we've recently launched our online courses. So I did my refresher training again, and it's great because one of the things that I realized that is you do look at it from a lens of self. You look at it from a lens of how you support your colleagues, but then you could also look at it a lens of how you support your friends. We are training you for the awareness to help support not just work people, but those within your immediate circles. The crucial thing is, yes, we're not therapists. We know when the key thing is knowing when to sign off and sign off, and then signpost the individuals to the relevant support that is out there to really help them. But you're making a difference within that. But you can't do that in cultures that, again, like I say, that you are constantly having to struggle and fight every day for your justification of being there, when it shouldn't be that way.
No, it shouldn't. And that what you've touched on, it's very important, isn't it? We use the analogy a lot in the mental health and wellbeing space to put your own oxygen mask on first. And that is really important. And what you have to understand from a mental health perspective, that the role of a mental health first aider, it is very actually different to the role of a physical health first aider. They might sound the same, but they're very different. You're only going to have a mental health first aider who's probably going to be listening to quite tragic, harrowing stories, and hearing stories of trauma, ill treatment, social injustice, prejudice, and all of these life impacts that can trigger periods of mental ill health. And it's very important that, if you are a mental health first aider, that you're taking good care of yourself. And sometimes it could be that you hear a story and you need to take that time off, isn't it? Just to sit back and kind of, I need to go and talk to someone now.
100%. I think for our mental first aid, no, I definitely, and we always say at mental health first aid that your mental first aiders should take the time out and support that they need for themselves, because you are hearing these stories, and it can again impact how you're feeling and how you do. So again, coming back to the point where I guess the question becomes is how well are organizations supporting their mental first aiders as well as supporting the mental health and well-being of their employees, because both need that. And so it's quite crucial to understand the holistic way of doing it to ensure that people can take the time off. I mean, I'm in an organization where I can say hands down is the first organization I've actually whole entirely been myself, had the support I've needed whenever I've needed, and then I've never had to feel or justify anything else. And that, and amongst itself, alleviates all these stressful questions I would ask myself in previous roles of, okay, well, how do I have to behave today? Can I do this or can I do that? Oh no, I just got a shoulder on. And let me tell you, it's the most liberating experience I've ever had in my career, because now I can actually truly function to my best. because I'm not worrying about everything else that takes over and distracts me, because I have that full support. I can be myself. And in the days where I don't want to be myself, it's cool. Do you know what I mean? And, you know, I only wish that other organizations could emulate. Like I say, we still have work to do with the mental health first in England, but we acknowledge that and we're doing that. And, you know, I would love other organizations to follow the same suit, really. Because how often do you have people like me sitting here talking about how great the organization is, because they truly are, like, they really care about people, and we have to be, because for what we stand for. We can't sit here and be something else and then preach to other people to do it, and we're not doing it ourselves.
Yeah, it's the same at EventWell. Same at EventWell. Do you know, we've come to an end. I've let it go for like the 5 minutes over, because you know, I could listen to you all day. Ama, I've learned so much today as well. So thank you so much for coming and
having me.
It's been a pleasure, absolute pleasure, for you to join us today. Really has, really has. We will be sharing your contact details after the event, if that's okay. Ama, if anybody's got any questions, they can come to you directly. And
I hope you found it a useful session. I do get quite passionate about these things, and some of the things I want to talk about go out the window because I'm just led by the conversation. But thank you for having me.
No, we love passion. We love passion here. So you can bring your passion in abundance. It will never get questioned ever. So we'd love to have you at some future stuff as well. So we'll chat about that, and we'll probably have some details about that coming soon. But Ama, thank you so much. Thanks to everyone for joining us.
Thank you.
See you next time. Thanks.
Take care. Bye.
Bye.